Hello and welcome. After a sluggish start to our vaccination program, India is now rebooting. On the 21st of June, in a few hours from now, a new policy for COVID-19 vaccinations comes into effect. India is now shifting to a centralized procurement of vaccines, something that experts had been advocating for months. So here's what's going to happen. Under this new reoriented policy, the centre will be directly procuring 75% of the doses manufactured by vaccine companies and distributing this among the states at no cost. It is to be administered free. Now, the vaccine guidelines 2.0 that had kicked in way back in May that allowed states to buy 25% of doses from vaccine makers to inoculate those in the 18 to 45 age group at government facilities has now been junked. Now, remember, the last month we saw states struggling to procure vaccines despite many of them floating global tenders. Now the centre says it will buy, starting from tomorrow, it will be buying and giving the jabs to these states free of cost. So, what does this mean for you? Will it have an impact on your pocket? For sure. Now, under the own program, we had a confusing multiple vaccine price regime. Now, private hospitals will continue to buy the remaining 25% and inoculate those who are willing to pay for their jabs. They can't, however, charge more than 150 rupees as the service charge per dose over the fixed price of the vaccine. So what changes for you? What does this mean for you going forward? Well, we have a panel of experts joining us. We'll have Dr. Arvinder Soin, the chairman of Medanta, the Liver Transplant Institute. We'll have Dr. Sunila Garg, a professor of community medicine at MAMC, a member of the Lancet Commission COVID India Task Force. We have Dr. Shashank Joshi, member of the COVID-19 Task Force of Maharashtra. We have Dr. Vishal Rao, the Dean of the Center for Academic Research, the HGC Cancer Center, member of the Expert Committee of the COVID Task Force of the Government of Karnataka. And we have Dr. Anupam Sibal, the Group Medical Director and Senior Pediatrician of the Apollo Hospitals Group. Dr. Soin, I want to start with you. You know, after weeks of cases stabilizing, states are opening up. I mean, Delhi is opening up bars. You can go from tomorrow to a bar and get a drink. Obviously, then you're not wearing your mask, and the government says 50% capacity. Of course, many people not even seated to get a drink, and you can stay out there at these bars till 10 p.m. We are now at the same time anticipating a third wave. Some say even in as early as 6 to 8 weeks. Now, you had tweeted, how can we take the sting out of an impending third wave? You said by administering 3 times as many vaccines as we are currently every day. Is that possible? Can that be possible under this new restructured policy that begins in a few hours from now?
So this is certainly very good news that everyone over 18, that means all adults, are actually entitled to free vaccination. And of course, those who want to and can afford private vaccines can go to private hospitals. So that's obviously good news. Now, as far as, opening up the bars and malls and shops are concerned, I am quite concerned about indoor crowds. So I think that I've said this before, and I think it's a good move to open public parks and outdoor spaces where people can go, and yet they should be careful. But opening up indoors and allowing unlimited crowds just by saying that only 50% of the establishments are going to be open is a very bad idea. And even if we are ramping up vaccination, like we've seen that Andhra Pradesh has actually administered about 10 lakhs vaccine doses today, it doesn't mean that you throw caution to the wind and do not observe COVID appropriate behavior. So I think that overall, the onus is not just on us. Of course, it is on us to observe, COVID precautions, but the government has to enforce it. Yeah. I think unless it is enforced by taxes and penalties and fines, it's not going to happen. And just because we are ramping up vaccination doesn't mean that we're ready to go out in the open and congregate. So that's a bad idea.
So we must, I know as you mentioned, it was ironic that we could not go to a park, or children who've been locked down for months now could not go to a park and run around in the open air, but you could go to a mall, which is a closed space with the centralized AC, and our, administrators thought we would be safer off in a mall than we would be out in an open park. But that said, Doctor, again, what you're emphasizing is even though we are ramping up vaccinations, we have to continue to have enforce COVID protocols. We have to double mask. We have to not be around anyone else within 6 feet distance. So you're saying that we can still get reinfected?
Absolutely. Absolutely. I think that, it's a myth that the waves will be spaced apart by a defined period, 3 months or 4 months or 5 months. It all depends on whether we behave appropriately. If we get crowds together, you're going to get your third wave much sooner.
Much sooner.
And then people are not vaccinated, and that leads to generation of even more variants and mutations. And you're going to get worse disease and higher numbers if you're not careful.
So that's going to be a recipe for disaster. Dr. Shashank Joshi, the Maharashtra COVID task force also seems to have raised that alarm, because they've talked about 2 to 4 weeks until we have a third wave. This really means, as Dr. Soin had tweeted, that authorities everywhere must spring into action immediately. Your concerns in Maharashtra?
We have two concerns. We have a large population which is not vaccinated. Over the next 3 months, we need to vaccinate 1 crore per day and saturate at least 90 crores to 100 crores Indians with vaccines. And unless and until we don't do that, we will not be able to mitigate the crisis at hand. Without saturating 70% of any geography with vaccines, if we unmindfully unlock and do not follow appropriate protocols, as Dr. Soin said, have crowding, poorly ventilated environments, it is a recipe for disaster. And these waves, see, all we said is that the gap, the first wave and second wave, the mistakes we made between the two of them, we should not repeat. Now, between the second wave is not yet over. Even today, we have 58,000 cases reported, 1,400 deaths from India, and we have a large part of India which is still in the second wave. And even when the second wave is not over, some geographies have come out of it, like say Mumbai or Delhi. We should not be in an exponential hurry to unlock. We should unlock for economic reasons, but following strict adherence to protocols and behavior. And the type of crowds we are seeing in Mumbai and Delhi is very, very worrisome. So all we red flagged in that meeting with the Honorable Chief Minister was that if we do not follow appropriate protocols and we allow crowding to happen, then it will be a recipe for disaster. And as Dr. Soin rightfully said, we will have mutations, we will have another problem on that. So we have to, in the next 3 months, are make and break for India, if you ask me. And we have to, and we welcome the central government for their aggressive vaccination strategy. And we hope and wish that there will be a liberal free flow of vaccines in the next 3 to 4 months. We'll be able to vaccinate a large proportion of the population.
We may not even have 3 to 4 months, but you say, as you correctly point out, Doctor,
that they need to follow behavior. If we don't follow the behavior, we'll lose the battle again.
As you correctly point out, Dr. Joshi, there are parts of India that are still in the midst of the second wave. A lot of this possibly in rural parts of India that we don't hear about. You don't hear those pleas asking for oxygen cylinders, etc. on Twitter as we did in the height of the second wave. Dr. Vishal Rao, so right now, if we need to protect ourselves from a third wave, there are two complex challenges that need to be immediately focused on. One, of course, vaccine hesitancy. Two, the much discussed digital divide in our country. How can one push this vaccine drive deeper and deeper into rural India, into the hinterland? Our government says the economic impact from the third wave will be less than the second and the first, but rural India's already will be going into a next wave with little less cash and no savings.
Yes, sir, I agree. In fact, if you look at, for example, a state like Karnataka, we've completed around 23 to 20%, 27% vaccination at this juncture, and we still have a long road ahead. Now, if you look at the age divide, we have more than 80% of our population who are below 45 and only 20% who are above 45. While we are pacing up on the age group of above 45 for the first dose of vaccination, where we have touched nearly 60%, yet there is a significant gap in the below 45 age group where we need to ramp up. Now at current state, we are at about 2 lakh vaccinations per day. And there obviously seems to be an urban-rural divide, which needs to be, I think, narrowed. This gap needs to be narrowed. Only then will we be able to achieve better penetration and preventing the third wave significantly. So there are a lot of steps being taken by the state government to actually ensure that there is larger facilitation at PHC level, and there are improved measures to overcome the vaccine hesitancy at the grassroots rural level. While at the same time, I would like to point out that during this current second wave, there have been some very key learnings, and I would like to allude to the Singapore's end of the circuit breaker model, I think, which was very logical, where they said that the unlock should happen in 3 phases. The first is the phase of safe reopening. The second is the phase of safe transition, and the third is the phase of safe state. Now, in the first phase, they very clearly and logically argued that this being a socio-economic virus, you should open up only limited economic activities and not open up the social or entertainment activities. This has to be a very clear message across to all state governments. Do not encourage social and entertainment activities. Help the daily wagers, help the people who are looking at monthly salaries, help them open economies restrictively. And in the second phase, which is the phase of safe transition, if the 7-day moving average of the positivity rate is less than 5% while you are doing maximum testing, it is at that time that you slowly open up the entertainment or social activities in a restricted manner and parallelly aim at 60% vaccination for the population. And during this phase, it's very important to have very active genomic surveillance so that you are picking up which are the new variants that are coming up and try to prevent an April from happening again.
All right, so is anybody listening, and are we learning from the experiences of other countries and what they've gone through? But Dr. Anupal Sibal joins us. Doctor, before I go to you for the question everybody is worried about, you're a pediatrician, children, how are they likely to be affected? I want to first just touch upon a very important, I'm not sure how much attention it got, but a very important study that was conducted by the Apollo Group, a multi-center study on a cohort of over 31,000 vaccinated healthcare workers across India that found that COVID-19 vaccines provide protection against the infection in 95% of the beneficiaries. If you could just tell us a little bit about this study, because to a layperson like me, it's important because these are people who are exposed every day, consistently, all the time, every day being exposed. And we've also heard, I think it's important to touch upon this because we've heard stories about doctors dying, nurses dying, and at a time when there is vaccine hesitation, it's important to point out the results of this study.
Thank you very much for having me on your show. So we actually did 2 studies. The first one was a follow-up up to 100 days. From the 16th of January when the campaign started for vaccination. And that was 3,235 healthcare workers in Delhi. And in that phase, we found 2.68% of healthcare workers became positive. They had an infection after vaccination. Now, in this larger study that went across 23 cities, 31,621 healthcare workers, and this went on till end of May. So this included the second wave. We found that the post-vaccine infection rate was 4.28%. But the good news was that hospitalization was 0.28% and the need for ICU was 0.01%. So what's the message? And we used both vaccines. Covishield was 91.5% and Covaxin was 8.5%. That both the vaccines provide protection, point number 1. And these are healthcare workers who have a greater exposure. Yeah. Both the vaccines prevent against hospitalization, serious manifestations, ICU, need for ICU admission, and very importantly, death. So that's a very positive message. The second point I'd like to make is that when we looked at the first 100 days and we looked at the genome of those who were infected, we found that 47% was Delta. And when we looked at the subsequent data, which included end of May, we found that Delta was up to 77%. So despite Delta being the predominant infection, the protection was there. And that again is a very important and a very positive message that vaccines prevent against serious manifestations of the Delta variant.
So the crucial takeaway again to remind anyone, all our viewers, that you can be vaccinated, you can still get COVID, but it will not be as serious. It could save your life certainly and prevent you from having to be admitted to a hospital. All right, Dr. Sibal, now with many states in India beginning this unlocking process, people have started stepping out once again. Is it advisable to let our kids out, the only age group which cannot yet be vaccinated? Can they go out? Can they socialize? You know, Telangana says it's going to open up physical school and colleges. So not just online, but kids are going to be going in physically to school.
So I think, as has been emphasized and keeps getting emphasized every day, that COVID avoidance behavior is something that we have to accept. It's here to stay. And when we talk about COVID avoidance behavior, it's about proper masking. I mean, you can move, go to any market and see people are wearing masks, but they're not really wearing masks because they're below their nose and so on. And, people have their own interpretation of hand washing and sanitization and, of course, social distancing. So COVID avoidance behavior is here to stay. Now, kids have suffered a lot. Young kids, 2-3-year-old kids, they haven't met any kids their age. Kids haven't gone to school, nursery, play groups, and so on and so forth. So we want them to get some kind of a normal, experience that is so important for them. But yet we have to realize that we are not quite ready for this. It has been seen over and over in countries that if you actually rush into opening schools, very soon you have to close them. Because one kid gets it and other kids get it. And I think we are nowhere near opening schools, because you can't really protect a four-year-old from not spending time with his classmate. I mean, they're going to eat together, they're going to talk. So it's not going to happen. So I think going to a park is perfectly fine. Taking a child out to play is perfectly fine. We have to walk the talk in that children will do what they see their parents do, not what they're told to do. So, if they see parents wearing the mask properly, the older kids will do that. For younger kids, it's very hard. You can't really get them to wear a mask. So one has to use a fair amount of common sense in allowing kids to do things that they really want to do and not be casual. I think that's really important.
All right. Dr. Sunila Garg, we've stopped talking about herd immunity. We've just stopped talking about that. Is that because there are always mutations now? Like today also we're talking about this Delta Plus variant.
Thank you so much. I think we never stopped talking about herd immunity. We are looking at different kinds of sero surveys which are giving us, prevalences of, recently yesterday only we had a survey from AIMS along with WHO, which showed, how much is the seroprevalence between the children and along with the older age group, and we found that almost, 56% of the children were also infected, So but then, another thing which is important is that the very fact that we are focusing upon vaccination, because always remember that herd immunity will come with vaccination. We have seen the example of smallpox, we have seen the example of polio, the herd immunity, or we are seeing the example of vaccine preventable diseases. So herd immunity always comes with immunization. So that is why the thrust is that everybody should take 2 doses of vaccine. So that is the one important option which will prevent us in long run. And as has been pointed out by previous experts, that we need to look at that how early in a phased manner we can immunize as early as possible, whether their individuals are priorities, first 45 to years and above, but we have immunized substantial number of people in that group. Now we have to focus in 18 to 44 years, but I will still say in that also, if we can look at people who are suffering from comorbidities and all. And then another thing, where as we move ahead, we will have to, when Dr. Sibal was talking about children, so I think that as soon as the vaccine for the children, they, clear the trials and all, we should start with children who are about 12 years of age, because we have seen lot of obesity in this group of children, and they are the ones who are also suffering from comorbidities as well. So this is where it is important, and herd immunity plays a very, very crucial role in protection against the COVID-19, and we need to look at from the vaccine perspective, and we need to vaccinate as early as possible.
So perhaps if and when Pfizer comes to India, then it should be kept aside or at least prioritized for use on kids children above 12, as it's been cleared for children above 12 globally, the world over. All right, let's remember now, India is now recording less than 60,000 cases a day of new COVID infections. This has been for over 80 days now. We need to build on this, and we need to make sure we don't lose the advantages, the gains that we've made over the last few weeks. Thank you all you doctors for coming on We the People tonight, and again reminding our viewers about what we need to do to save ourselves and to keep our loved ones safe. Thank you for your time. Thank you for your service. Welcome back. Now time for our special campaign, Vaccinate India, in partnership with Google. With overall COVID-19 cases in India declining consistently over the past few weeks, several states have started easing COVID restrictions. Crowds have started swelling in markets, in our malls, and people can be seen not wearing masks. All of this could lead to an increase in cases again, and the only way really that you can protect yourself is to follow COVID appropriate behavior and to vaccinate. And so we have this special show to answer any of your questions that you may have about vaccines, and we have our expert of the day. We have Dr. Sunila Garg, a professor of community medicine at MAMC, a member of the Lancet Commission of the COVID India Task Force, a fellow of the WHO and the ICMR. Dr. Garg, thank you for joining us. Thank you for your time. First of all, I just want to reiterate something for all of our viewers. Vaccines mitigate the chances of contracting COVID-19. There's no caveat to this singular truth, correct? That vaccines' effectiveness cannot be questioned.
Definitely. You see, basically what we have seen, and earlier also we have been discussing, that you can, vaccines' effectivity cannot be questioned. But still, along with the vaccine, most important is to follow the COVID appropriate behavior. That is one thing which we have to keep in mind. And I always say that mask is your most important social vaccine. So also, the people who have been vaccinated, they have been, severe infections are not there, hospitalizations are prevented. So we say that vaccines will, 100% we cannot say that vaccine will not prevent you from getting the infection. Even if you get the infection, they will be milder in nature. And the second thing is, chances of hospitalization are very, very less. So these are the two important things. And as we go ahead, you see, these are the initial vaccines which have got emergency use authorization. And gradually, as we go ahead, we'll be having a lot of vaccines in our kitty, which will also be much more helpful and in having a better efficacy as well. But we need to keep a watch on our vaccines efficacy, and looking at the gene sequencing as well.
So vaccines are the final frontier, but that doesn't mean you let down your guard. You still have to wear masks for a long time. So again, to clarify, doctor, we hear that you get these messages from companies saying that all their delivery boys have been vaccinated, or you go to a restaurant, they say everyone in our store or our restaurant has been vaccinated. If you see that you're about to enter a store, you still cannot take off your mask or stop COVID protocols. Is that correct? I just want to reiterate for our viewers, just because you're with a group of people who've all been vaccinated, you still have to keep your mask on?
Thank you so much. It's a very wonderful comment, which as a public health expert, I keep telling everyone, wherever you go, you must make sure that you are wearing the mask and the other person is also wearing the mask, and not only wearing the mask, but wearing correctly. And let me tell you, in India, only 50% of the people are wearing mask and only 15% are wearing it correctly. So that is important part, and this message, we need to disseminate through your channel again and again. And that is one thing you can imagine, that only out of, we are talking of 15% correct usage. So that is important.
And doctor, the second wave took a massive toll on all of us. Not only did it highlight the poor state of our country's medical infrastructure, the big question now is we need to prevent this third wave from hitting us again and hitting us so hard. When we talk about COVID prevention, what is it that people who have started to let down their guards need to know about COVID-19? Maybe the new variants of COVID-19, and what they need to know about COVID prevention. And what would you like to tell our viewers right now?
See, one thing, the message which has to go from this channel and from your side is that primarily we have to see That second wave was many times. I'll say it was, almost 100 times, because we never expected it will come in this form, number one. Because we had so much of, not only infectivity but also severity. Our systems were full, and it was a usual, I think there would be no one who would have called the hospital and he would have found out that bed is not there. Oxygen supplies went, out of our reach, remdesivir was not there. Then there was a lot of, work on the therapies, remdesivir and all that were also just not available. And then, we looked at our protocols again. But another thing, right from the beginning, which we have been telling that, as of now, from what protected us from the first wave was, it was only masking, social distancing, sanitizing, testing, treating and tracking. So these are the mainstays of prevention of corona infection, and which should be followed at all times, and this is for the times to come. And this is one thing which even in the oldest time, go back to Spanish flu also, this was the scenario where everything was not there. So we have to follow this, and we are a signatory to global health security. And these are all a part of our global health security, whether we talk of prevention or our systems.
All right. And on top of this, of course, vaccinate everyone
Absolutely.
that you can. Thank you so much, Doctor. In Andhra Pradesh, I just want to end on the note that Andhra Pradesh, the state of Andhra Pradesh, has set a new record today by administering over 1 lakh doses of the COVID-19 vaccine. That was till 6 p.m. In the process, they've also crossed the 1 crore mark in the administration of the first dose of the vaccine. And officials say credit goes to the network of volunteers, to healthcare providers who made this possible, with the understanding what was driving them is the thought, the understanding that vaccines are the only way to stop COVID-19 and to keep us all safe. Thank you all for joining us.